What is going on, guys? Josh Baldwin here from Mad Money Millennial. And in this video, I wanted to talk to you guys once again about the cost of living adjustment, how it affects Social Security benefits, how it affects beneficiaries, how much you guys are going to be receiving in your checks next year. So we're going to cover all of that information in addition to some information on the consumer price index and how the COLA was calculated based on the consumer price index for urban wage earners and clerical workers. And we are also going to watch a video from Mary Johnson. Many of you know Mary Johnson, who is the Social Security and Medicare policy analyst, one of the primary spokespeople for this program, who is part of the Senior Citizens League. All right, so she is part of that organization, and she does a lot of talks on the subject of Social Security and Medicare. All right, so we're going to cover all of that information. So thank you guys so much for joining, and let's get into it. So in this article by CNBC, it says that nearly 6 million older adults are living below the poverty line. All right, so that's a very, very large amount. And I think we have around 77 million seniors total. So 6 out of that 77 million are actually living below the poverty line. The poverty rate is actually increasing for Americans over the age of 65. According to US Census Bureau data, the share of older people that are living below the poverty line actually rose to 10.3% in 2021, up from 8.9% in 2020. So obviously a very, very large jump there due to all of the inflation that was happening over the course of that time period for seniors. A couple of the things that you can do in order to combat inflation and to get yourself back on your feet a little bit and to relieve some of this pain, one of the things that you can do is apply for food benefits or SNAP. All right. It says that a 2015 study actually found that less than half of eligible seniors participated in the SNAP program. So a lot of seniors are actually eligible for this program, but they don't take advantage of it. So I want to make you guys aware of it just in case you are eligible for this program. This will definitely provide you a lot of relief. They tend to regularly provide extra food benefits for seniors. So that's what the SNAP program does. The extra money can go a long way for retirees on a fixed income. The maximum benefit a household can receive per month for a household of one is $250. And you can use your EBT card to purchase food at grocery stores. You can purchase products on online retailers like Amazon. I've seen programs for Amazon and farmers markets as well. The U.S. Department of Agriculture also has another program for seniors called the Commodity Supplemental Food Program. And this program is another food benefits relief program that basically provides low-income people over the age of 60 a monthly food package that contains fruits, vegetables, cheese, and more. So if you're over the age of 60 and you're eligible for this program, you can receive a nice little care package there of healthy foods for you. If you are on a Medicaid health plan, you may also be eligible for free food through the Mom's Meals program. All right, so this is another food benefits program that you can potentially take advantage of. It says that, and some Medicare Advantage health plans offer meal benefits under the program for those recently discharged from a hospital or dealing with a chronic disease. So seniors in any sort of extenuating health circumstances will most likely qualify for this program through Medicare. The meals are typically delivered every 2 to 3 weeks and include some pretty tasty dishes here, including Salisbury steak, pasta, and sweet and sour chicken. All right, so definitely take a look into the Mom's Meals program as well. We've also got information on how health insurance and drug costs are going to be changing next year for seniors and how exactly the government is going to be providing more benefits. So obviously, health insurance is very, very expensive. Prescription drug costs can get very, very expensive. So in order to combat some of that financial burden coming from increased healthcare costs, these are some of the programs that can help you out. So some seniors may be eligible for assistance keeping up with their monthly premiums under the Medicare Savings Program. All right, so this is a program that will help you pay for your premiums, deductibles, copays, anything that requires a cost when it comes to your healthcare. This program will help you out in covering some of those extra expenses that you can't cover. In addition to the Medicare Savings Program, those enrolled in Medicare Part D, which covers prescriptions, should also look to see if they qualify for the Extra Help Program. So this is another program that can help you with your payments related to prescription drug costs, in addition to the other program I was just mentioning, the Medicare Savings Program. So this program can reduce the costs related to your drugs and can be worth more than $5,000 a year. All right, so that's pretty significant. So if you're in the hospital a lot, you've got a lot of medical expenses, definitely look into the Extra Help program and the Medicare Savings Program. In addition to these, there are a number of charitable organizations that help seniors with healthcare expenses as well. For example, copays.org. This is a website where you can apply for funds that people will provide to you to cover your copays, your premiums, deductibles, and over-the-counter medications. All right, so another organization that will help you out covering your healthcare costs is copays.org. All right, so there's 3 programs for you guys: copays.org, Extra Help, and Medicare Savings Program. So look into all 3 of those to maximize your savings for healthcare. All right, other options that you have: if you are extremely low income, you may be eligible for the SSI program, all right, the Supplemental Security Income Program. This is a program for people over the age of 65 or who have a disability. So this is another form of disability benefits, the SSI program. And if you're part of this program, your supplemental payout can be as high as $841 a month for an individual. All right, so definitely a significant amount that can help you out and provide relief for you if you're experiencing financial burden. And so it says, for more help, the National Council on Aging has a benefits checkup website where you can learn about more than 2,000 resources available to struggling seniors. So in addition to all of these programs that I'm mentioning just now, there are more than 2,000 actual resources that you can look into. So just to name, these were just to name a few, but there are several others that you can look into through this benefits checkups website. And the way you access that is you go to benefitscheckup.org. All right, so you enter your zip code, and then it will provide you with all the programs that are available to you in your local area. And I wanted to get into this video that I was mentioning at the beginning of this video, where Mary Johnson, the Social Security and Medicare policy analyst from the Senior Citizens League, goes and explains the cost of living adjustment and Social Security help that seniors are going to be provided next year. All right, so let's go and take a listen to that.
Social Security beneficiaries will see a 5.9% increase to their monthly checks in 2022. That's much more than the 1.3% adjustment made for 2021, and the largest increase since a 7.4% increase in the 1980s. For the 88% of the population over 65 who receive benefits, every dollar matters, and living on a fixed income takes planning.
It will give a really good boost for anybody who's been on Social Security for over 12 years. They've only received COLAs that have averaged about 1.4%. So this will give a boost in benefits to people who really need them. They've been struggling with inflation all year. They have fallen behind. They have had to deplete savings or draw down savings faster than planned. And this will provide a really important boost to their Social Security income.
Now, let's take a look at what the 5.9% raise will mean for people's benefits. The average retirement beneficiary receives about $1,513 per month in Social Security. Applying the new COLAs will raise that check to about $1,602, which is about an extra $89 per month, or around $1,071 per year. The extra cash is expected to start hitting accounts in January, so keep an eye out.
All right, so that covers the Social Security COLA that we're going to be seeing starting January 1st next year. And you can see there that Mary Johnson has a few comments on that subject. Obviously, she's very passionate about this and is excited that seniors are finally getting some relief. All right, now I wanted to get into this article as well from Tucson.com. It's titled, "The 2023 Social Security COLA Forecast is Great News for Retirees. Here's the real reason why." And what this article is basically going to get into is why the CPI-W, all right, so that's the Consumer Price Index for urban wage earners and clerical workers, is more advantageous to be used in the COLA calculation this year than the CPI-E, which is the Consumer Price Index for the elderly. All right, so this article will basically explain why that is. All right, so this is basically what I wanted to get into. There is actually a flaw in the way that Social Security COLAs are calculated. Social Security COLAs, as I was mentioning, are based on the CPI-W, which basically tracks a consumer basket of goods over a period of time. And that is supposed to measure what inflation is doing. The CPI-W, however, tends to underemphasize spending categories for seniors that are most prominent, all right? Things like medical care, prescription drugs, and housing. So a lot of these things, the average American doesn't have to worry about as much or as often as seniors do, all right? So that makes it so that the CPI-W doesn't actually accurately reflect senior spending. What it should be based on is the CPI-E, the Consumer Price Index for the elderly, because this index is based on purchases made by individuals 62 and older. All right, so that makes sense. Now, in a normal year, the CPI-E would actually provide more benefits in seniors' pockets than the CPI-W. It would have actually provided an extra $5,800 in benefits over the last 2 decades if COLAs were based on the CPI-E rather than the CPI-W. However, this year, the CPI-W was actually more advantageous than the CPI-E when it came to how much money seniors were going to be receiving as part of the COLA next year. So something actually odd happened in which the factors that are used to calculate the CPI-W actually raised the percentage, the overall percentage of the index higher due to factors that were being hit the hardest by inflation in the CPI-W were more significant than the CPI-E. So things like gas costs and things are part of the CPI-W. Obviously, we've seen gas prices rise significantly. And so that in turn made the CPI-W overinflated and actually be a lot higher than the CPI-E, which is not usually the case. What is usually the case is that the CPI-E typically puts inflation 0.2 of a percentage point higher than the CPI-W. But this year, the CPI-W was higher than the CPI-E. Therefore, since inflation as described by the CPI-W was higher than inflation described by the CPI-E, it was more advantageous to calculate the COLA this year based on the CPI-W. You see why that is? However, most typically, in most years, the CPI-E beats the CPI-W, all right? So in most cases, you would want the CPI-E to be used in the COLA calculation over the CPI-W. However, this year, it's different. So pretty interesting stuff. All right, now that we've covered the differences between the CPI-W and the CPI-E, and which one's more beneficial in which scenario, and the last thing I wanted to cover was when the actual COLA is being released. And this is going to be happening on October 13th. So this is 4 days from now, all right? So when the September inflation report gets released, this is the final inflation report that is used as part of the COLA calculation. All right, so that basically covers the COLA calculation, what seniors can expect going into next year, the differences between the CPI-E and the CPI-W, and a number of social programs and financial relief programs that you can take advantage of. All right, so I hope you found this video helpful. If you did, please leave a like. Comment down below any information you might have about your own Social Security or SNAP benefits, and maybe you can help someone else out in the comments. If you're interested in investing, you can click the Robinhood link down in the description, and you can get 1 free stock. And I hope you guys have a wonderful rest of your Sunday, and I will see you guys in the next video.